Welcome to another episode of the Golden Hour. I'm Sharif Yunus, here with Dr. Kevin Majors. Kevin, thanks for coming back and joining us again.
Yeah, Sharif, I'm looking forward to it.
Yeah, well, we have a topic today that gets right into one of the main areas of interest for you. You would call this your original specialty, your main specialty, right? Anxiety.
Oh, yeah, I love anxiety.
Okay. Not many people say that.
Well, hopefully they do after we work together.
Yeah. Well, and that's kind of the whole point of today's episode, right? Is gaining a deeper understanding of anxiety. And then once you really understand what causes it, then you can really learn to flip it, right? And to actually come to love it when you understand what it really is. So maybe, Kevin, just like a little background on you. I mean, how did you decide to focus on anxiety in your career as a psychiatrist?
But it started when I was in my residency training, and at some point, it kind of dawned, like it clicked on me. Partly, the lectures I got at UT Southwestern, which has a really great residency training program, and just understanding that the simple truth: the more you try to bring anxiety on, the more it goes away. And the more you try to avoid it and keep it at bay, the more it increases. And learning that when I started working with patients, that, wow, this is a really powerful truth of how anxiety works. And then just reading and learning about it, anxiety is so understandable. And in some ways, it's that people, we have all the wrong instincts when it comes, because you just want to avoid it. You want to make it stop. But in fact, if you can turn and embrace it, it's not nearly as bad as it seems. It's really not painful. And the better you are at opening up and connecting to it, the more it's energy you can use to get good work done. So that was I'd say right after residency, I had a patient who was a pilot and was flying a plane. And his co-pilot told this story of a dental procedure that went wrong, and it got gory. And when the pilot heard the gory story, he passed out while flying the plane and was grounded by the FAA. And he was one of the first cases I had outside of residency. And so working with him, it only took maybe it was 2 or 3 sessions to actually cure him of what was going on. It's a technical thing called needle phobia, but it's where people pass out when they are losing blood, or thinking they're going to lose blood, or giving blood. So, and then they pass out. And it's kind of cool among phobias because it's completely unconscious. It's almost like it's just a phobia that their body has, their amygdala has. And they don't consciously fear losing blood or, having needles, but boy, their body does. And so it's very treatable. It's very workable. And he was a very dedicated patient. He wanted to do the exposures fully, and he got really rapidly better. And then, so I did, those experiences of people being able to get better rapidly, and really the joy you get when you understand how anxiety works and what's going on. To me, it was super motivating. And so I started really looking forward to those cases of anxiety.
That's very interesting. And I imagine it must be just very kind of fulfilling or rewarding that you're taking people with anxiety, which they often think is something debilitating, or they experience it as being debilitating, something that they can't kind of deal with on their own. They might just have strategies for coping with it, and you can just really help them a lot very quickly. So, and now just kind of getting into that a little bit, because you mentioned this at the beginning, that we have all the wrong instincts when it comes to anxiety. Can you kind of clarify a little bit what exactly that kind of key misconception is that people have when it comes to anxiety?
That's a good question. I think probably the biggest misconception is that people over-identify themselves with the anxiety response. And so they think somehow this is just the way they are. And so even a well-known therapist will publicly describe himself as a panic disordered person. You'll say, I'm a panicked, and it's, whoa, to me, that doesn't really make sense. The response of anxiety is simply a state of training. It's a state of education for your threat detector called the amygdala. And so having a lot of anxiety in any given situation, it only means that your amygdala got trained to see that as a threat. Now, sometimes it's a little bit, you know, confusing to know, why did the amygdala get this idea? Where did it get this idea that something is a threat? In my experience, it doesn't really pay off to do historical detective work because it doesn't help change what you do. In the end, what you need to do is practice accepting and welcoming the anxiety. So people often think that this is just who they are, and they also think that somehow, like, the history of it makes it part of who they are. I think if we were to truly understand the whole story of anyone's anxiety response, we would say, yeah, it makes sense. One way or another, there was a message that was clearly given that something is a threat. And then that thing was in some way avoided. You tried to control it and avoid it. And that just heightened the idea that it's a threat. Because anything you avoid, your amygdala is watching and says, probably a threat then. He or she is avoiding it, must be something bad. The next time you see that thing, you're going to get a little more anxious in front of it. And if you avoid it again, it learns again the lesson. The next time you see it, you're going to be a little more anxious again. And that's the process of educating the amygdala that took place. And so the nice thing is, like, whenever someone is anxious and they ask themselves, why am I so anxious about this? Well, the real answer is because your amygdala is identifying it right now as a threat. And it also means that when you feel the anxiety, your amygdala thinks it's in the presence of the threat. As long as you welcome it and approach it, you will retrain it. And so if you approach things that make you scared, you're going to feel more anxiety at first, and then it goes away. But the next time you have less, and the next time you have less, and the next time you have less. So the people who persevere in approaching things that trigger their amygdala, the threat detector, those people always wind up retraining it. And those who avoid end up making it worse.
Now, is there any sort of belief component to this? In this, I remember I used to get very nervous before public speaking. I don't know if I would call it anxiety, but it seems like I'd probably in some way trained my amygdala over time to perceive public speaking as a threat. At the same time, though, I also kind of believed maybe I'm just not the type of person who's cut out to be a public speaker. So I had this kind of, like you said, like fixed mindset about myself. I mean, does that belief play into it at all? Or is it all just, the training of the amygdala? Or how do those two relate?
I think what the belief does is it gives us permission to not do the actual work of exposure. So if a person truly believed that, he or she is just never going to be a public speaker, then they're not going to accept requests to speak in public. And then there's no way for their amygdala to ever learn that this actually isn't such a threat. But say a person gets to a job that requires public speaking. Well, after a few times of doing it, then they start to see it gets easier and easier. Now, the fear of public speaking is probably the most common fear that there is. And so it's completely normal. Everyone basically has it. And if they say they don't, it's only because I think they probably got over it at a younger age. But it's just a kind of inherently threatening thing to be speaking, especially extemporaneous speaking, in front of a large audience. Now, that said, it can also be really enjoyable. And you can learn to take that adrenaline you're getting and use it to really perform at your very best. But you don't get that learning experience if you always are avoiding public speaking. And then so sometimes people say, oh no, I've spoken many times in public and I'm always equally anxious. In my experience, that's just because the learning episodes are too far apart.
So does everyone who gets practice public speaking then start to get rid of their anxiety?
I think the answer is basically yes, and especially if the practice is close together. So if you're getting practice, let's say you're in a workshop and you're getting practice twice a day or daily for a week, you're going to see really substantial gains. The problem is if you get practice once every 6 months or 12 months, it's hard for your amygdala to carry that safety learning across such a wide time span. So if you want more if you want to get, more practice, well, the more practice, the better. And if you get practice close enough together, you really do see it gets easier and easier as you get started. But eventually, the real key is not trying to get rid or lower your adrenaline at all. Let it be high. Even that very first time when the adrenaline's super high, you can flip it with reframing into like a super fuel for your brain. And that's the best part about anxiety is how flippable it is. And so, like for instance, we can help people reframe pain, but pain doesn't turn into like a superpower when you flip it. It gets better. And so you can help people reframe their experience of pain, be mindful of it. But boy, anxiety actually is like a kind of high level of performance waiting to happen. And it can bring out the best in you. And you can use that adrenaline then for whatever kind of stretching you're going to be doing in that hour. So whether it's physical, like in the actual fight or flight response, where now you're going to be running or fighting, or some higher level of performance, like most work.
Now, anxiety feels kind of very connected to fear. Is it what is the relationship or what is the difference between anxiety or fear?
Maybe the best way of distinguishing it is that anxiety is for imaginary threats and fear is for real threats. But just to clarify, anxiety means that the threat is not physically present to you at this very moment. It doesn't mean the thing that you're fearing couldn't at some point be real. It just means that right now it exists in your imagination. So that when you forecast something bad happening, getting an illness or getting fired or something, then then you experience anxiety right now. But should you actually be seeing a cobra in your living room, then you would have fear. But in the end, it's really, I think, a distinction that is, perhaps not super useful because I think it's all the same. It's simply that your amygdala is detecting a threat. But I like in some ways to highlight it because most of the things people are afraid of, where it's a clinical disorder, they're actually imaginary in that they're coming from the thoughts they have about some situation or about themselves in a situation. And so even if you're public speaking, well, they're really afraid of getting embarrassed in public, kind of losing face in front of a bunch of people by being embarrassed in public. But so, should it happen? Yeah, it would be real. But for the most part, it never happens. It's just something that the very possibility as they think of it makes them kind of get a charge of adrenaline. And that's like the typical thing of anxiety. It's really you're just thinking about the future, imagining it, and then it causes it.
And then with the anxious response is characteristic of that the way that the body uses the adrenaline is to help the person engage physical challenges, right? So it's related to the fight or flight response, which is not what you would want to engage intellectual challenges. So in the public speaking example, someone was like, well, there is a physical challenge that says that there are people there watching me speak. But the point is that it's a kind of more of an intellectual challenge. That's what's needed. So there's a difference there in the relationship with adrenaline.
That's right. And so if you're judging this thing to actually be a threat, then the effects of your alarm are going to be primarily in your periphery, in your body. Your heart rate's going to go up. You're going to start sweating. You're going to feel an increased drive to breathe. And so even though you don't perhaps need to, you're going to feel like you have to breathe a lot more. And so you can flush or blanch, turn red or white. You get trembly as your muscles are ready to exercise. So all that you would think of as external manifestations of anxiety, that's just your fight or flight response kicking in, but you're not actually using it to flee or to fight. Well, the way to shift the response is simply to reframe the trigger. Reframe the entire event. Reframe your adrenaline itself. See, okay, this is a wonderful opportunity for me to actually perform at my best. Now, there's a saying that Barbara McAfee quotes in her book Full Voice that fear is simply adrenaline without the breath. And so the moment you're feeling fear and you actually bring the feeling of the breath into it, you connect with it in a new way and it becomes excitement. So that's why I always encourage people to ask themselves on a scale of 0 to 10, how anxious are you? And then see if you can feel it, in especially the very front of your chest. It's a little bit of tension there. And if you slowly inhale, you can feel it stretching that tense area. And then let the exhale happen on its own, just exhaling, relaxing, and you feel it subsiding. So you can feel in the front of the chest a kind of tension that increases and decreases with the breath. Well, if you're able to feel it like that and use the breath to feel it, you are already in a kind of physical way reframed it. You're seeing it as something to approach and to learn from and be curious about. And then you add to that the mental idea of like, this is exactly the kind of opportunity I need to retrain my threat system, to retrain my amygdala, to become confident in this situation, to have courage. However you put it, it's the opportunity to gain precisely what you want. You can only train your amygdala when it's firing. So you can't train it really in an imaginary way, just by thinking in advance about it and trying to convince yourself something really isn't a threat. Unfortunately, it doesn't work. But when the alarm actually sounds, your amygdala, I guarantee it, is trainable. And you do that by welcoming the sensation, welcoming the whole situation, and then leaning into the challenge. So you're kind of just showing your amygdala with deeds more than words that there is no threat here. And gradually then it gets used to giving you the actual right amount of adrenaline that you need to actually perform at your best in that situation. Like publicly speaking, you do want adrenaline. But this way, it just turns out to be then more perfectly measured to what you need, and it simply feels like strength and confidence.
And earlier you mentioned exposure, giving a patient an exposure, walking a patient through an exposure. I wonder if you could talk a little bit more about that as it relates to this idea of, bringing on that challenge and encouraging that shaping process.
Yeah, so with exposure, I think the older approach to exposure was we're going to use this to completely quash your anxiety. So we're going to do exposures until anxiety is gone. I think that's maybe not the most useful way of thinking about exposure exercises. Instead, they are practice learning to welcome the sensations and still perform at your best. And so whenever you have anxiety, what you want is simultaneously learning to reframe it and be mindful of the sensation, welcoming it, and then also have some actual real positive goal of how you want to be. And so for instance, if a person is afraid of heights and you say, okay, well, great, I have a balcony here in my office. We're going to go on the balcony. And let's say that triggers, say it's a guy, it triggers his fear. Well, as long as he can see going on the balcony as exactly the training he needs, he has the reframe. He's saying, yeah, this is an opportunity for me to overcome my fear. It's exactly the opportunity I need. And then he tunes in to feel the sensation in his chest of the fear. It's interesting. The moment you feel the anxiety with the breath, feel it in the chest, it sends a very powerful message receive signal back to your amygdala so that it doesn't keep increasing the message. So then he can go onto the balcony, welcome the sensation of anxiety, especially in the front of the chest. And then I would say the third step of challenge is you lean into it. So I would want him to go to the railing and slightly lean over. And then maybe in his head be repeating, I'm going to fall, I'm going to fall, I'm going to fall. So just to get the anxiety really high. Well, if he did that, his anxiety would go high momentarily. But within 90 seconds, if he really is practicing those steps of reframing, being mindful, and then leaning into the challenge, it can be very fast that the anxiety would actually go away. That's the beautiful thing with anxiety. The more eager you are to make it go high and higher and pushing it up eagerly, the more it just drops to nothing. But the more you try holding it down and keeping it low, the more it just keeps incessantly rising. And so I see exposures like that then are the best way of teaching people reframing and mindfulness and leaning into the challenge. Now, as a side effect, the next time the person comes and does it, he has much less anxiety. But you don't want to make that the main goal, because you could still then be thinking anxiety really is something bad that you have to quash. And that's what we're trying to help people to see doesn't have to be the case.
Kevin, we just have a couple minutes left, but I just wanted to maybe use my final question to ask about kind of what people can practically do. It seems like exposures are something that should they be doing them on their own, or what are the kind of steps that you would advise people to kind of take on their own in dealing with these issues?
Well, one thing is any work that people do with the breath, like our last one, making the breath regular through the nose, not the mouth, feeling the breath extends the belly, but primarily because that's the diaphragm moving, but you also want to be feeling it in the chest. The better people get at feeling the chest move with the breath, the more ready they are to process the signals of anxiety that come when they live their life. If you're not good at feeling things in the chest, the sensations move elsewhere. And it gives rise to the psychosomatic symptoms, where you get headaches instead, or GI problems instead, or back pain instead. So what you need to do is instead reopen up the theater of the chest, which is where your amygdala wants to show the signal and where you then can read it most efficiently. So if people are really practiced at feeling things in their chest, then they just can welcome whatever practice happens to come along as they live their life. So I don't think people need to necessarily be, constructing situations of exposure. But if you want to prove the truth of what I'm saying, if you have a thought that worries you, simply write it down and read it and reread it and reread it in your head silently. Let it saturate your mind so that you're able to drop your defenses against that thought, just let yourself experience it, and simultaneously just be welcoming the rise of anxiety and the tension in the chest. The more you can experience this, the more you're welcoming the anxiety higher, the more quickly it just starts to fall away. But it's not because we're trying to get rid of that thought. It's just that it's a good way of practicing how do you welcome anxiety. Once people learn how to do that basic thing, I think every step in life where your amygdala fires is just a chance to retrain it. That's the thing I love most about anxiety is it just shows people in such a concrete way how shapeable they are. That these things are not who they are, they're not determined. And once you understand what's going on, it can be an enjoyable process to retrain it.
Awesome, Kevin. Well, thanks so much. I think this was a really helpful session. So
great. And if people have any questions, just leave comments on YouTube, or you can email this at OptimalWork, and I'm happy to talk about this anytime.
Awesome. Thank you, Kevin. Okay, well, we will be back next week.
Sharif.